All right, so antibiotics are actually a major part of human and animal medicine and could have a lot of benefits in their usage to battle disease conditions. But there are a number of misconceptions that people have as concerning the use or the usage of antibiotics. And today we'll be talking about 5 misconceptions or wrong ways people view antibiotics. First on the list is the fact that you should use antibiotics to make your animals grow bigger. Now, I believe the first person that must have given that advice is a terrorist because you should not do that. The consequences or the downsides of using antibiotics that way as a growth booster or something is very harmful to your practice in general and as well human health. This abuse of antibiotics makes the bacteria that these antibiotics are supposed to fight immune or powerful against the antibiotics, such that when the animal actually comes down with the condition where you require to treat with antibiotics, it just might not be effective. So you do not want to do that. Second on our list, that you could use antibiotics to prevent diseases in your animals. And that is not true. Antibiotics cannot be used as a preventive measure. They only have efficacy when there is already a bacterial infection or a bacterial disease to be dealt with. Then you could bring in their usage to battle that. Next on the list is the wrong thought that you must use antibiotics if you would raise healthy animals, or you could not exactly raise healthy animals without having to use antibiotics. And that is not entirely true. There are a lot of things that could result in disease conditions. It can be poor hygiene, not vaccinating your animals against common conditions. It could be a lot of management and environmental factors that if you put in place, you really would not have the disease conditions present in your animals to start with. So you might not exactly have to need antibiotics. But when you neglect these, you neglect vaccination, you neglect proper animal care practices, you neglect the environment or the surrounding that these animals live in, then these things would bring the disease to your house, and then you have to start using antibiotics. But if you put these measures in place, then you just might not be needing them to grow your animals. Next on the list is that you can stop the usage or administration of antibiotics once the animals start improving and they no longer show the serious signs of the disease condition they were previously battling with. And that is not true. Once antimicrobial therapy has been instituted, you must see to it that you complete the dosage, because yes, the animal might start improving, but you want to be sure that you have dealt with the entire bacterial load that caused the infection in the first place. So yes, the animal might improve after a day or two, but if the antimicrobial therapy duration should be for 3 days or 7 days or whatever number of days, you would want to stick to that, because the initial development in condition might just be as a result of the load reducing such that the animal can now start to operate, but the entire load is not down yet. And if you do not attend to that, what could happen is the condition could relapse, or the bacteria start getting resistant to that antibiotic, and it could just then lead to the whole problem of antimicrobial resistance that has really been a problem to healthcare around the world. Another important one, second to the last, is the saying that usage of antibiotics in animals does not exactly affect human health. I also think the person that said this or brought about this misconception must be an assassin, because the usage of antibiotics in animals largely affects human health as well. Because if you abuse antibiotics in animals and there develops a resistance in this disease pathogens in animals, when this particular bacteria that has become resistant to certain antibiotics infect humans or cause disease conditions in humans, the humans in the case now would not exactly respond effectively to the antimicrobial treatment that is being administered to them. So yes, abuse of antibiotics in animals, though might not be the major way, but it contributes pretty much to antimicrobial resistance in humans. And last but not the least, just another addition, because people don't really say this, but they act it out. And it's the thing that antibiotics can solve or would be a solution to just every and any disease condition. And that is not true, because there are a lot of organisms that result in disease conditions. It could be bacteria, it could be viruses, it could be fungi. So you do not want to, animal having fever, antibiotic. Animal stops eating, antibiotic. Yellowing of the eyes, antibiotic. Animal is not moving, antibiotic. You do not want to do that. You would want to be sure of the condition. You want to be certain it is a bacterial infection and what antibiotic is that particular bacterial infection susceptible to before administering therapy. So yes, if this information has been pretty helpful, do not forget to leave a like, leave a comment, or ask questions in the comment box below, and do not hesitate to share this video to someone who you think might need it, a pet owner, a farmer, or just someone who should know about this. Stay safe.